Hi guys, my name is Raisha Nurani. I'm a GP ST3 in London, and today I'm going to talk to you about how to approach an information giving station. Now, most of the cases you see in the CSA are a clinical encounter, a clinical case, and that involves taking clinical history and then doing examination and then doing management. And I've discussed this in my previous videos. Please have a look at them on how to approach the first 5 minutes and the last 5 minutes of a CSA. Information giving stations are slightly different. You will encounter one or two of those in your CSA exam, and essentially you're given some results. So these may be blood tests showing some abnormal results, or imaging results with some pathology. Generally something will be wrong because they do want to test your management skills and how you're going to deal with that, but it doesn't always have to be the case. And this seems to frazzle a lot of people because suddenly it raises issues of when do I give the news, how do I approach my structure, can I still take a clinical history when I've got all of this involved, and I think trainees find information giving stations slightly more challenging than a standard clinical case. So what I plan to do is just tell you how I approach an information giving station and give you a few tips and tricks on how to manage that type of station. So some trainees, what they like to do is they like to do their clinical history, examination, and then when they go on to do the management part of their structure, they will give the results at this point and incorporate it into their management. If this works for you, that's fine, and you need to do something that you're comfortable with more than following someone else's way of doing things. However, I feel it may not be the best way of approaching an information giving station, and the reason for that is well, there's a number of reasons for that. So I will approach an information giving station by giving the news a lot earlier on rather than waiting for sort of the latter part of that consultation. And the first is having been a patient on the other side, it is immensely nerve-wracking to sit there and wait for the doctor to give you some sort of news, and frankly sometimes a bit cruel. So I think you need to approach that with a better sensitivity, and patients do not like to sit there and think, well, when's she going to tell me, when is he going to tell me? So I think giving it earlier on is the kinder way of doing a consultation. I think also what struck me is I saw a CSA case where there was an excellent candidate who was giving some information, and it was some horrendous news. It was something like MS or cancer to this patient, and what happened is she did it by giving the clinical history first and then decided we'll give the information in the latter part of the 10 minutes. And what happened in that situation was they built a bit of rapport. Patient started telling her about how she's getting married and she has all these plans for the future, and you could almost see the patient becoming more and more positive. And then when the news came, it was like she was dropping a lead balloon. It was such a the tone of it was so far away from what it should have been, and I think giving the information early on helps to set the tone for the rest of that consultation. So what you don't have is a sort of clinical history with no real set agenda, but actually by giving it early on, what you've done is you've set the tone and you're kind of walking on a path with your patient on a journey towards the management plan. So I think it comes across better in that sense. Lastly, in terms of exam strategy and getting those marks at the top, I think giving information at the beginning is often looked upon as being more slick, because if you are a confident trainee, you will tend to give information early on. The reason for that is because you're more flexible. You don't need to stick to your rigid, oh no, I must do clinical history first and then do management, and only can I give it in management. The second reason is if you are nervous about giving information, you will naturally try and prolong it to later and later in that consultation. Whereas if you are confident, you will be able to take it on its head and be able to give it that news a lot earlier. So I think there are a lot of benefits. But you have to try it out, see if it works with you, works with your style, and get comfortable with it. So what do I do? So essentially what I do is I ask 2 questions and no more than 2 questions at the beginning of my consultation. So they will be is really asking, do you know what tests you've had and why? And what do you think the results will be? And those are pretty 2 standard questions I ask in any information giving station. And they have 2 benefits. The first is to help me build some sort of rapport before I break the news. The second is they give me an idea of where the patient is at and where I need to go. So if you have a patient who is not expecting bad news, you know that that's going to be a bit more difficult and challenging compared to someone who is coming in and they are expecting it to be bad, or they know their, I don't know, their diabetes control is poor, and you're just reaffirming that. So I think those two questions are helpful, and they're not long enough to make the patients feel like, well, when is she going to tell me? So then how do I transition back into my standard clinical history and examination and management? Well, it's just a few nice, neat phrases that I would use. So something like, okay, I know that you were worried about your blood sugar levels, and I agree that they are high this time, but what I really want to do is get a feel for what's going on. Do you mind if I ask you some questions? I'm sure you have a lot of questions about this, but we haven't met before. Is it okay if I ask you a few more questions? And then you neatly go straight back to clinical history and go through your structure, and it works well. Give it a try, guys, see what you think. If you have any questions or comments, please put them below. Please subscribe to the YouTube channels, that helps them go up in their search results, and I wish you the very best of luck revising.